I'm Dr. Phil Kieran.
And I'm Dr. Pixie McKenna. What can we do?
We'll be travelling around the country with our pop-up clinic and seeing patients with all sorts of health worries.
As far as
That's as far as it goes.
Yeah.
Plus, we'll be bringing you advice on the latest medical developments.
Talk to me about bioidentical HRT.
So you know what you need to know to stay healthy.
This week in the clinic, Pixie examines a patient with 2 odd feet.
That's just weird, isn't it?
Phil waxes lyrical about an ear problem.
It was blood, very dark blood was coming out.
And Pixie cheerfully spreads some germs so that your child might not.
So in here, I've got some germ sprinkles.
Here we go, germs for you.
We've come to Currickmore House, Portlaw, for the Waterford Country Fair. First into the clinic is 32-year-old single parent Tracy Haid.
What can we help you with today?
Basically, I have pelvic pain since I had my daughter back in 2014. I got pelvic girdle dysfunction when I was pregnant, and then it has continued. It hasn't gotten any better. I'm never without pain. Oh, that's your baby.
Tracy lives with her daughter Ruby. She struggles with pain every day.
She needs to be warm, does she?
Yeah.
In an ideal world, I'd like to be completely pain-free to get back to what I love doing. Enjoy my life with my daughter. She rolls around on the floor, and it'd be nice to be able to get down on the floor and play with her as well, but I can't do that. I might do it for like a few seconds, and I'm like, no, I have to get back up because it gets too sore. You push her down? There are days I can't lift her, like there's no physical way I can actually pick her up. Good girl, well done. And sometimes they need that comfort, if they're upset especially. Whoa, 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 whoa. Now go! Whee! Every single day, no matter what I do, that pain is there. Even getting a job or doing a course or something, do you know, getting back to normality. Not sitting at home doing nothing, because I've worked all my life up till I had my daughter.
How severe is the pain?
It can go up to a 9 on its
9
worst.
out of 10.
Yeah, where I actually can't get up and walk.
Agony.
Like, I'm trying to lose weight. I'm actually doing Slimming World, so I've done very well so far on it. I've lost a stone.
Fantastic.
And that's all to try help this.
Try and help this.
But I can't exercise.
What I think we need to do, Tracy, is to take a look at this hip in a bit more detail and see what we can do to help you. Follow me through this way.
Okay.
And we'll have a look and see. Can you lift that leg up for me as high as you can?
That's about as high as
that's sore, is it?
Yes.
Okay. And push up against my hand with the leg. Okay, so the strength is okay, but that's sore to do, is it?
It is sore to do, yeah.
And if we just roll your leg there, is that okay?
No.
No, that's sore as well,
I gave
is
it a bit of a jolt there, actually.
On the way out, is it?
Yeah.
I'm just going to bend your knee up a little bit here now. And if I press...
Oh, yeah.
That's sore?
That really is sore.
Okay. We might sit you up and have a chat to you about what's going on. There's a hormone called relaxin that's produced in pregnancy, which actually causes the joints to stretch a little bit. And usually after you deliver, that all goes back to normal again, okay?
Relaxin is a hormone produced by the ovaries and the placenta in preparation for childbirth. It relaxes the pelvic ligaments and widens the cervix to ease delivery of the baby.
The problem is if you get some malalignment or some muscle weakness during that, it can cause further problems down the line, you know. I think you probably do have a bit of pelvic girdle dysfunction. The next step for you would be to see a physiotherapist who specialises in this type of area, okay? All right.
It's serious.
It is serious. It's having a big impact on your life. So let's try and get it settled, all right?
Perfect.
Thanks a million for chatting to us, Tracy.
Thank you for having me.
At the Irish Maritime Festival in Drogheda, Malcolm has come to see Pixie about something that he's been worried about for 7 long years.
Have you any idea what it is?
Well, I thought it was a hernia, but...
It is a hernia.
Yeah.
It's an umbilical hernia. Umbilicus is the doctor speak for belly button. So a hernia, basically, in layman's terms, there's a gap, there's a design fault here, and what's on the inside is poking out. And when we talk about hernias, we talk about them as being reducible and irreducible. A reducible hernia is a hernia that I can put back in. They become problematic when they poke out and they get stuck in the hole. And they can become strangulated or incarcerated. So you might get a piece of bowel stuck in there, and that might compromise the blood supply, for example, to that area. So that's an emergency. And I guess what worries me about this is you can push it in, But it's not that easy to get it in. And also you've got a great big gap here, which means this is only going to get bigger. Would you mind?
No.
So I think it would be worth seeing a surgeon to get an opinion as to the next steps in terms of repairing that. If you were to have a surgical procedure, what's very important is weight. If you wanted the best surgical outcome, would be to try and shift a few pounds. All right?
Yeah.
You look worried now.
Well, yeah, it's a bit more concerning because I didn't think there was any problems, you know, just always...
Yeah, this is not going to sort itself out.
Back at the Waterford Country Fair, 34-year-old Barry Goff has come to the clinic to discuss his feet.
Now, what can I do for you today?
I've got bad feet.
Right,
Yeah,
okay.
just bad kind of yellow nails. I've got bad skin on my feet.
So, ugly feet.
Ugly, embarrassing feet.
Are they sore? Are they uncomfortable?
Not sore, but they do get itchy and I feel like they're burning every now and again.
Okay.
My girlfriend put me up because I've been complaining about my feet for years. 15 years, 20 years, yeah. You'd be quite self-conscious of it. You wouldn't go around town, nice summer's day, you wouldn't go around with your flip-flops on with feet like that, you know. Go to the gym a bit and swimming, love swimming, so yeah, try to go 3 times a week if I can. I mean, you're in the water, nobody's going to see your feet, you know. In the steam room, no one's going to see your feet. It's okay, you know. You get into the water, it's quick. It'd be great to get a diagnosis on what it is and hopefully get to the bottom of it and get it cured once and for all. That'd be the best thing.
Anything work for you? Anything make them better?
I've tried everything, to different powders, creams,
Yeah.
paints, and gone as basic as just putting my feet in salt water.
I thought you were going to say urine, because
No.
people do that. Yes.
No.
No? Okay, I'm not advising
I haven't
that, by
gone
the
that
way.
far, no. Yeah.
So nothing's worked.
Nothing's worked.
I've got a pair of ugly feet myself, so...
You won't beat mine.
All right. Let's not have a competition. Right, over here with you.
I'll wrap it
Okay, just through here. Okay, right. So you've got 1, 2, 3. Nothing on there.
Yeah.
That's just weird, isn't it? And this has been like this for years. In
Teenager,
school,
I suppose.
teenager, yeah, maybe. Yeah. Right, let's have a look in here. Lots in here as well. And then again, you've loads on the soles of your feet as well. Whatever the origin of the problem with those nails, there is no cream in the world that's going to fix those, right? This is a fungal infection, and it's just likes you an awful lot. And this can spread to other areas of your skin if it's fungal. Do you ever get skin irritation in the groin? Do you ever get, no?
No.
Okay, because sometimes these fungal spores will sit in your underpants, when you put your underpants on, and then you'll get what the Americans call jock rot.
Yeah.
So technically, you should put your socks on before your jocks. Socks before jocks is the rule. Feet are probably the most neglected part of our anatomy, and in particular, men tend to put up with issues with the skin in their feet or their nails until it becomes really, really bad.
Pixie will arrange for Barry to see a skin expert to try and get to the bottom of his long-term foot problem.
I'm just going to bend your knee up a little bit here now. Press.
Oh, yeah,
That's sore?
that really is sore.
Okay.
Earlier, mum of one Tracy Haid came to the clinic looking for relief from 3 years of pelvic pain. Phil has arranged for Tracy to visit physiotherapist Sarah Mullins of the Milltown Clinic.
This started when you were pregnant?
Yeah, it was about, what, 12 weeks?
12 weeks, okay, so quite early, okay, poor thing. Yeah, it's a very, very common problem. So I would see lots of women every day here. It's an area that I would specialise in here at the clinic. A recent study has even come out, it's called the MAMI study, so it was a study done on Irish mothers.
The MAMI study found that although 1 in 3 women in Ireland suffered from pelvic girdle pain during pregnancy, it went undiagnosed. PGP symptoms include stiffness of the pelvic joints, difficulty with walking, sitting, sleeping, climbing stairs and exercising.
Okay, so we'll start with the left side, keeping the legs straight and lifting it up from the bed and back down again. So if you had to give a score from 0 to 5 for that side.
Probably 2.
2, okay. Slightly heavy, perfect. Okay, and then if you do the same on the right side.
Oh God. Yeah,
harder?
That's a lot harder. I'd say about 4.
4, okay, so 2 and 4. I'm just gonna have a little check. There's a muscle here, and this muscle attaches into the pelvis, but can be quite tight.
Oh, Jesus.
Okay. All right, sorry now.
Yeah.
Is that sore?
That was very sore.
With pregnancy, your body just works harder. Your muscles have to work harder to carry the baby. So the muscles around the hip can actually become a little bit switched off. If there's a restriction and it's not able to do the same thing that the left side can do, that's where you start to get an issue and you get pain. And a treatment that I would use quite often is a treatment called dry needling. It sounds a little bit scary.
Dry needling involves the insertion of a long, narrow, pliable needle directly into the area of pain. Dr. Pixie McKenna and Dr. Kieran have been travelling the country in their pop-up clinic, seeing patients with all sorts of health worries.
Oh, yeah, that really is sore.
It's just weird, isn't it? Whatever the origin of the problem with those nails, there is no cream in the world that's going to fix those.
Earlier we met Barry Goff and his 20-year foot problem. Pixie has sent him to see Dr. Naomi Mackle in Limerick to investigate further.
Do you have any hobbies like swimming or Bikram yoga or something that could be causing it?
I do swim.
You swim, and do you wear protective shoes or not?
No.
So what I'm looking for there is any sign of athlete's foot. Do you see this red scale? That is athlete's foot, okay?
Athlete's foot symptoms include cracking and scaling of the feet, redness, blisters, itching and burning. It is mildly contagious and is spread through direct contact with towels, shoes and floors.
How long has this been here for?
20 years.
20 years, so you can wait another couple of weeks.
The fungus on Barry's nails is still a problem. Clippings will be sent to a specialist lab to identify the exact strain. In the meantime, Dr. Mackle prescribes a cream for his athlete's foot.
And the Dr, of course, is just the cream, so you put that on around the heels and in between the 4th and 5th toes twice a day until the tube runs out or the rash goes away.
In Limerick, Phil meets a patient with a runny ear problem.
Now, Tom, what's the problem today?
Problem is, doctor, there's wax runs from this ear.
It just starts running out of the ear.
I can feel it running down the side of my face, yeah.
And how long has that been going on for?
2.5 to 3 years.
That's a while, isn't it? And any itching or pain in the ear at all?
No. Well, about a month ago, it was blood, very dark blood was coming out of it.
Any problems with the hearing in that ear at all?
When I have the cotton wool in, the hearing is bad. When I take the cotton wool out, I can hear
away.
away.
Cotton wool in it at the moment?
Well, I have to put it in or it's just constantly running.
Yeah. Okay, so there's actually quite a bit soaked into that, isn't there?
Yeah.
And have you used anything to try and treat this up to now?
Tried 2 courses of antibiotics, drops into the ear.
Okay,
Stop
it didn't go away.
Didn't stop it, no.
And this one's not sore today or anything like that, is it?
No.
So there's quite a lot of discharge in there, isn't there?
How do you mean discharge? Like
there's quite a lot of liquid,
which
is on the bottom of the ear canal, and it would flow out. It would look like it's working its way out. It's a thing called a chronic otitis externa. And one of the difficulties can be is that it can be caused by a fungal infection a lot of the times, and that can be a little bit tricky to treat, okay? When you were using the drops, were you told about keeping the ear dry? Was that ever stressed you?
I was just told on the side to make sure it was in, and straight away put in a piece of cotton
wool. So what I would say to you is over the next week or two, okay, is to keep the ear completely 100% dry, okay? So when you go into the shower, you put a bit of cotton wool with a small bit of Vaseline in onto that part of the ear to stop water getting into it, okay? I think it would be worth talking to your GP again and seeing about maybe getting a referral to an ear, nose and throat specialist if it doesn't settle, because what they'll do is they'll actually suction all of that stuff out of the ear first, but firstly going with some antibiotics, tablet antibiotics, and some drops for the ear that will cover for a fungal infection as well, and then just keeping the ear really, really dry. Okay.
Right, thank you.
A lot of people feel that they have to clear the wax out of their ears with something. Your ears are self-cleaning. There are little hair cells in there that will actually remove the wax if you leave them alone. By putting something into your ear, what you're likely to do is damage those hair cells pack the wax in harder and potentially injure yourself.
In Aston Village Educate Together School in Drogheda, Pixie has come to recruit some junior doctors to help demonstrate how easily germs are spread.
Well, I only got sick when I had the sniffles. And my nose was blocked because the buggers were blocking it. I was hot and I didn't even get better until 40 days. I had to drink 7-Up and I usually don't like 7-Up.
We all know that certain germs can make us sick. In the winter months, viruses are responsible for coughs, colds, diarrhea and vomiting. They are highly contagious and they breed best in confined spaces, like classrooms.
To show how contagious these bugs are, Pixie is going to create her own outbreak using the best germ spreaders around.
Now, what I want you to do is I want you to put your hands out for me. Excellent. I want you to help me to show everybody in the school how germs spread. So in here, I've got some germ sprinkles. There we go, germs for you, and germs for you. They're not real germs, okay? They're fake germs. Okay, this is a special magic torch. This shows up invisible germs. Well, do you want to go in and play nicely? And I'll come back and we'll see what happened, those invisible germs. Off we go. Yes, a train. Picking up all teddies. So this is a hive of activity. My little germ doctors are getting stuck in. And I think we are really going to see lots of these invisible germs just spreading like wildfire through the classroom. The germs can actually remain there for hours and be spread to other people. So I think this is a real opportunity for our germ doctors.
Okay, so we're going to make our cues. It's week 3 of junior infants, and by week 2 we had runny noses.
And I suppose if there's one child in the class who even has a runny nose or something like that, that spreads like wildfire.
Oh yeah, absolutely. By the end of the few days, everyone at their table will probably have it. But they're constantly touching their faces when they're playing with the toys, so it's like an incubation room in here.
What we're seeing here, there are lots of germs deposited on this hard surface. And this isn't just with kids, this is with everyone. This is how germs get spread. I go in, I use the loo, I've coughed on my hand, I put it here. And sometimes germs can remain on a hard surface for hours or more.
Flu and cold viruses can thrive on hard surfaces for up to 24 hours. And norovirus, the winter vomiting bug, can survive for weeks. Norovirus can be spread by infected people handling food and not washing hands after using the bathroom.
So let's have a little look then, Christian. We're going to look at your hands first of all. Okay, so you've got some invisible germs on your hands. Let's have a little look at your face. Oh, Christian! You've got a big stripe of invisible germs on your face. You've just got a little tiny bit on your nose. Our invisible germs went right under Amy's nails, and that's where invisible germs like to hide.
Hand washing really is your greatest defence. Wash your hands with warm water and soap, rub all areas for 15 seconds and dry thoroughly. Don't splash and dash.
They do forget, so you have to constantly be reminding them, wash your hands, wash your hands.
Soap and wash it with water.
Eating a healthy diet, getting lots of sleep and taking regular exercise will keep your immune system strong. But if you want to keep the germs away, then a little bit of hand washing will go a long way.
The germs are not there anymore.
In Limerick, Barry Goff is back with Dr. Naomi Mackle for a checkup and to get the results of his nail clippings analysis.
How did you get on with the cream?
Cream is excellent.
Okay.
My heels are pretty much after healing up. No more blisters on my heels. All
Super.
the redness has gone down.
Great. The good news is I also have a result on the nail clippings, and the nail clippings show something called trichophyton rubrum, which is a fungal infection. I have a tablet that should clear it completely. This is a prescription for oral Lamisil or terbinafine, and it's a tablet, and you take it for 3 months. Now, it's extremely important you follow this treatment. You can't stop it. You can't stop it because you have a weekend away or anything like that. You have to take it for 3 months. But it will take 12 to 18 months for your nails to return to looking normal. But the worry, I suppose, for you in the future is you could be reinfected by other people, especially in somewhere like a swimming pool.
Yeah, so I wear flip-flops in and around the changing room and in around the pool.
Yeah, I think after 20 years of infection, I probably would wear swimming socks for the rest of my life if I were you.
Yeah.
But
just have to be diligent.
Exactly. You have to take it, you have to complete the therapy, and you have to make sure you don't get reinfected again.
Yeah.
Earlier, at the Waterford Country Fair, Tracy Haid came to the clinic suffering with severe pelvic girdle pain. Phil sent Tracy to see physiotherapist Sarah Mullins, who's going to administer dry needling therapy. The insertion of a long, narrow, pliable needle directly into the muscle.
So you're going to feel a little plastic tube. And just a breath in for me. Good.
Ooh.
There we go. Okay, so that was a little twitch there.
Yeah, I felt that pain.
It's a little tight spot there.
Oh, now I can feel a bit of pain.
Oh, that was a really good one. Yeah, did you feel that?
Yeah, I felt that one.
It's a little bit jumpy.
Yeah.
Are you okay?
Yeah. It's just a strange sensation.
Feel a little bit there now?
Yeah.
Another little jump. We're nearly finished now. We're nearly done.
That's okay.
That was a little twitch there.
Oh,
okay.
that hurt.
I'm going to come out with that one.
Yeah.
So I'm just going to go back and just show you that muscle now.
Okay.
How's that feeling there now?
That's much different.
Okay.
Wow.
Better?
Yeah.
Good.
A lot better.
Good, good.
That's amazing.
So when you're ready, I want you to come back onto your back for me.
Yep.
So if you lift that right leg up.
Oh my God.
Okay. And back down
Slightly
again.
heavy there, but yeah.
So 0 is no problem at all, and 5 is you couldn't do it. It's too difficult.
It's between kind of like a 1 and a 2.
Okay, so the last time we scored at 4.
Wow.
So yeah, try the left as well and just see is there.
Even that's much easier.
And that's easier. Okay, what would we score the left
That's
one?
1.
1, okay. So take your time, just if you bend up your knees, that's it. Sometimes just bringing them out. Exactly. How is that to get up? No problem?
Better.
Okay.
Much better.
Okay, and let's have a stand in just the same position there again. Yeah. And then if you lift that left knee up in front for me. And back down. Okay, any pain there?
No.
And try bending forward for me as far as you can.
Oh my God, I can touch my toes.
Okay, good, good. And come back up again. Okay, any pain doing that?
No.
Okay, well done. You should expect to feel a change immediately, even from the treatment today.
Yeah.
But unless you keep those stretches going, you may feel that it starts to stiffen up again.
I'm feeling absolutely fabulous. I've the most pain-free I've been in years. I know I can move forward with exercise now. Yes, gentle at first, but get there and then get the weight down even more. Make me even more happy.